In Healthwatch, sickle cell disease is a rare genetic blood disorder that affects every aspect of a person's life. Predominantly impacting people of color, the disease has long been misunderstood by the community and even doctors. It's also historically come with some pretty unfair stigmas. I talked to patients about a new initiative at Carilion that's offering extra support. Sickle cell anemia is what Tanisha Dudley calls an invisible illness. You wouldn't know it by meeting her, but she's faced a lot of battles.
Right now it's going okay, but it's not easy. My life is not easy.
In sickle cell disease, red blood cells become crescent or sickle shaped due to a gene mutation. These sickled red blood cells don't move easily and can block blood flow to the rest of the body. There is no universal cure.
This isn't known as a disease that affects African Americans. They've historically been neglected by society, by the healthcare system. So to finally bring light to this disease, it's huge.
Sickle cell disease is hereditary. Tanisha's son, Isaiah, has sickle cell too.
What was that like, as an adult and dealing with sickle cell your whole life and then having a baby and then finding out he has sickle cell too?
Scary, very scary. I'm glad I have my mom.
In addition to attacks of severe pain known as pain crises, there are often severe complications. Tanisha has already survived 2 strokes.
I think I was on a ventilator that time for 5 days, but I stayed in the hospital 27 days. Then I had my second stroke at the end of April of this year.
So that was the scariest because cognitively she was there. When we went in to see her that morning, her eyeballs were huge and teary, and she knew everything that was going on, and she was trying to talk, but she couldn't.
How's your pain?
Good. That's been good.
Tanisha's nurse practitioner, Karen Marable, is there to be her voice.
But a lot of practitioners look at our patients like they're drug seeking. No, they have chronic pain. Their organs are damaged. Their bones are damaged.
I've been at the emergency room in the sickle cell crisis, and I know what I need, and I know what medications help me, and I tell them, and they still won't give me the medicine.
So decreasing that stigma is probably the most important aspect for me.
That's why Carilion created the Sickle Cell Collaborative.
We needed a multidisciplinary team to address all of the issues.
Callan Trent, a community health worker, is part of the collaborative, acting as an advocate to ensure patients have what they need.
Things like access to healthy food, or do you have transportation to get to your medical appointments, or do you need help with finances so these things can get paid for and ultimately uplift your health.
They even have patient get-togethers. We were there as a patient throughout the first pitch at a Salem Red Sox baseball game.
We're giving them a community where they can talk about it.
Ensuring better access to care, reducing the stigma, and raising awareness about the disease.
People with sickle cell are human, and even though we may look normal, we are still fighting an invisible illness that doesn't have a cure.
And Tanisha is such a wonderful person.
Wow.
You know, she is just incredible, so strong, really inspiring just talking with her. And this weekend, the Sickle Cell Collaborative at Carilion is holding a walk to raise awareness about sickle cell and recognize local patients as well as their caregivers. That walk is Saturday from 9 a.m. to 11 a.m. at Carilion Clinic Riverside campus. And it was so wonderful and important for Tanisha to talk about her story, share her story so she can help others.
She just seems so resilient, and to be able to do exactly that, to share her story, to break the stigma and raise awareness, is just incredible.
Yeah, you know, she talked about having, you know, a really strong support system with her mother and her family, and not everybody has that, right?
Right.
So that's why the collaborative is so important.